Good morning, Wise Tribe. I'm here at Osler Health International and I'm here with Dr. Neil Forrest to talk about men's health and when our partners should come to the doctor. Hi, Dr. Neil again.
Hi.
I know it is fact that men are more likely to die younger than women.
Yes.
One of the reasons for that is that they're just reluctant to come to the doctor to talk about their problems and to seek treatment. Why is that? You're a man. Give us some insight, please.
Well, you're absolutely right. Men have lower life expectancy than women. I think probably not going to the doctor as much is a small part of that. There are biological reasons as well. But it's true that it's important when we're doing a talk like this, a conversation on men or women, it's a generalization. So I've got lots of male patients who are very happy to come to the doctor and present their symptoms, but on average, men visit their doctor fewer times in a year than women do, and that seems to be cross-cultural. It's not just one country that defines that. Why are they less likely to do it? I think there are a number of factors within the sort of male psyche and personality. There's a tendency in men towards more risk-taking behaviour, men do more sort of risky jobs and risky activities, again, on average. And I think sometimes that translates to a more easygoing or blasé approach to physical symptoms. It'll be okay. That's not a big deal sort of attitude.
That makes sense.
I think sometimes there's an embarrassment to come and talk about certain things. Lots of men that I know who are very confident, social, outgoing types clam up when they go to see the doctor. And that obviously doesn't happen to me, so it's a difficult one to explain, but they do. I think also the relationship men have with other men, so women with their friends talk about their problems more, and I think that leads to women advising each other sometimes to seek help, whereas men in conversation tend to escape that. They actively avoid talking about their problems with their friends. They talk about something completely different. That's how they switch off. And so men aren't as encouraged by their peers to go and see the doctor.
Definitely. Following on from that, obviously a lot of families will come to see you, the mother, the father, the children as a unit. Is everything that somebody might come to present to you with, is it all confidential?
Yes. I mean, that's an absolute. So just because I happen to see someone's partner as a patient or someone's kid as a patient, those consultations, those conversations are completely firewalled from each other. It does help me to know the family context sometimes, and that's one of the advantages of seeing a family doctor is they can see you in your family context. But sadly, even if it's your partner who's asked you to come and see me, I don't then feed back to your partner. Once you're in the room, that's it. It's between me and you.
Yes, good to know. Because I think that can be a big barrier as well. Often, we have thoughts, we have issues, we have ideas in our own head, and I think often there isn't a safe space. You mentioned talking to friends and colleagues, even partners. You may not feel comfortable having certain discussions as an individual. So I think it's a great opportunity just to come to a doctor who has a wealth of information, professional, and personally you see a lot of different situations.
I think sometimes we can give people perspective on how they're feeling. Sometimes it really might not be a big issue. Thankfully, most of the people who come to me with symptoms or problems don't have some life-threatening or huge problem, and what they need more than anything is some reassurance and just someone who's seen it before to tell them, don't worry, that's okay, or it'll get better, or whatever it is. I think, as we probably discussed in some of our previous chats, I think in the international community here, people might not have as close friends as maybe they would back home to talk about sensitive stuff with. So I think that's somewhere where the doctor can be quite useful, because it's confidential, it's separate from your friend's family, work, it's a completely fresh conversation. So
objective.
Yeah.
So talking about some of the symptoms and problems that people do come to you with, what are the main overarching issues that you see in men's health?
Okay, well, it's hard to cover everything, because the majority of symptoms affect men and women in equal measure. But if we focus on what men come to see with, I broadly divide it up into physical health. So everything from boring things like COVID and coughs and colds. Certainly men, there are a number of conditions like cardiovascular disease, high blood pressure, heart attacks, angina, diabetes, which affect men and women almost equally, but tend to affect men at a younger age.
Right, so that I was just about to ask that. Is there a particular age group for those things? What kind of
there is. So for example, one of the things we do here is annual screening for men and women, and there are a number of things that we screen for in that sort of cardiovascular area, where I started younger in men than I would in women. So up until the menopause, women are relatively protected by hormones in their body against cardiovascular disease. That's the reason for the discrepancy. Menopause happens on average at 50. Most women aren't going to run into problems in that area prior to 50, whereas many men will. There's a reasonable proportion of heart attacks and heart problems still happen in younger men. So we've got our eyes open for that sort of thing.
So sort of 40 plus? What's the bracket there?
It's very dependent on your other risk factors. Do you smoke, are you overweight, etc. But we start having those conversations from the 40s onwards. Cancer screening and cancer symptoms, I would say, are almost flipped the other way. So lots of women will start certain cancer screening quite young. Pap smear, cervical cancer test from 25 recommended, some countries 20. So that's on their radar quite early. They may even start breast screening from their 40s onwards. Whereas men, we kind of get left alone. Nobody talks to us about cancer screening. And then suddenly, through your 40s and 50s, we're recommending a colonoscopy every 5 years, from 45 onwards. Prostate cancer screening from the 50s onwards. So there's a lot of this stuff that men haven't had to think about when they're younger, and then suddenly they go to the doctor and they feel like they're getting hit with a list of things to be on the lookout for. But of course there are cancers like prostate and testicular cancer that are exclusive to men. So thankfully I don't see a lot of cases of those things, but it's something that men come to see me about. They might have a symptom and say, is this a sign of cancer X or cancer Y?
So those are physical issues that people might come to you with. What other?
So I'll talk about the mental health side of things in a minute. The bridge, I guess, that overlaps between the two is sexual health. So things like erectile dysfunction, really, really common. 10-20% of all men at any given time, and has a number of underlying causes, both physical and psychological. So that's a common one. So clearly something that men are really embarrassed to come to the doctor about, and shouldn't be, because it's a conversation that I have every other day, and we have good treatments for. So sexual health, both sexually transmitted infections, erectile dysfunction, libido, a whole range of things there. And then mental health, another huge one. Become bigger with the pandemic as well, of course. Probably the three most common things I see are depression, anxiety, and burnout. But there are others as well. And I think that's probably one that men find the hardest to come have the conversation, in my experience, when I see a man, if we take depression as an example, a man will come to see me later in the process when it's harder to unpick everything. Yeah, they'll have let things get worse before they do. And that's probably true of physical symptoms as well.
Right.
Men do eventually go to see the doctor, but they let things get worse before they wait until the building's on fire before they do anything.
So how can we, as partners, help them identify that actually this is heading in that direction, it's getting extreme before the building starts to burn down? When we see smoke, what are those smoke signals that we're looking out for, that we can look out for symptoms to kind of then say, look, dear, I think you might want to think about going?
So the first one is exactly that, encouraging men to go to the doctor when they've got they'll often complain about symptoms at home but not do anything about it. So encouraging them to go to the doctor in that situation is number one. I think sometimes, particularly in the mental health areas, it may be along the lines of saying, look, I can see you're struggling. I don't really know how to help you with this, or I've tried and it's not working. Why don't you go and see someone independent and professional and have a chat about it? So that would be another way in. And then the other one I see is lots of men here either do an annual screening already, or are entitled through their company or their medical insurance to get an annual screening. And that's quite nice because it means I get to sit there normally for an hour with someone, go through everything. It's not like a therapy session. It's we go through their family history, what do they do for exercise, how much do they drink, do they smoke, all these things, but it allows the conversation to start. It's not really a tick box conversation because they've done a questionnaire before they come to see me. So I've got the tick boxes. So it's more about me finding out about their life, how long have they been there, what are their issues right now. And so if it's something they're reluctant to talk about, doing it within the context of an annual checkup can be quite a nice way to break them in gently.
A good way to nag without nagging.
Yeah, I think so. And also, a lot of men are doing this anyway, going through the motions of having an annual check. So why not make it useful and actually, get some value out of it?
Yeah, and I think an hour is actually a really good, decent amount of time to let people offload a little bit. I think there aren't really places that you can go to do that, and it doesn't feel like they're being interrogated. I guess if you're here for an allowable reason, permissible reason, which is a medical health check.
The other thing I see on that front is that some men, or some men and women, it's been organised through their company. So they get sent somewhere for the check. Everyone goes to the same place, but they might come and see me with their results because it hasn't really been explained to them. You get you get the email at the end with here are our recommendations, but no one has a chat to you about it. So sometimes guys will come to see me who've actually had all the tests done already. They just want to talk through the results.
And another opinion, because often there are those really confusing ranges and charts and things, and it might say something, but then you go and Google it and the ranges are kind of different, the advisory is different.
Most abnormal results on a medical screening that are out of range don't require any action. They're just out of range. It's nothing to worry about. It's important to miss the ones that are important, but when you do that many tests, there'll always be one or two that are not quite in the range, and most of the time we can safely ignore those.
Very good to know. So is there anything in terms of things that might be going on under your own roof, awareness of different patterns, different things that might be happening that we could perhaps observe that our partners might not be aware of themselves?
I think the kind of things I see here, and again, I'm sort of stereotyping and generalizing a little bit, but it's often the men in the house that are not really thinking about overall health and the health of the family and lifestyle. So they might not be exercising, they might be eating terrible diets. Often they're working strange hours. They'll be in some sort of regional role where they're on a call at midnight to somewhere in the States or whatever, then they'll snack, then they won't really sleep, then they'll be too tired to get up and exercise in the morning. And that can happen to all of us, but I think it's often men that get themselves into that vicious cycle of a sort of spiraling unhealthy lifestyle. And so I think if you can fix that together, if you can eat meals together, sometimes even exercise together, or at least, it's very hard to change someone's lifestyle when you're just telling them to do it in isolation.
Yes, but I guess it's very easy as you just kind of talk through that scenario, especially when you're driven by work and external factors, and you don't have much control over what time those calls are, and you can't control your the amount of sleep that you're getting, the time of quality sleep that you're getting. You're sometimes not aware of it because it's happening to you.
And I think sometimes men don't draw connections as easily between physical symptoms and mental health. So they may come to see me and they won't say, I'm burnt out and stressed, so I'm not sleeping. They'll just say, I'm not sleeping. Can you fix that problem? Whereas the real question is, why are you not sleeping? They may have become more aggressive and snappy. That's often a manifestation of stress. And actually, people in the office are just thinking, gosh, this guy's horrible. But what he is burnt out or depressed or whatever. And I know we've spoken about that a bit before. So yes, I guess male manifestations of mental health are sometimes different to female ones.
Yeah, absolutely.
There'll be less. There might be less tearfulness. There might be less social withdrawal, and there might be more sort of aggression, insomnia, snappiness, lack of patience with the kids, that kind of thing. And so that, if that's not dealt with, it builds resentment.
Yeah, definitely. And following on from that, those are quite general issues, but are there things that we should be aware of that might manifest because we're living in Singapore rather than our home countries? Kind of grow up with different awareness of different health issues.
There are. There's we've touched a little bit on the mental health side on the difference of living overseas and isolation and social interactions and that kind of thing. On the physical side, it's a very hot, sunny country. So UV exposure is much higher, and we see higher, I suppose, higher rates of skin cancer within the international population here. The Singaporean population is much more diligent, much better at protecting themselves from the sun, and I don't see that quite so much in some of my international patients. There are some cancers. In the male context, we're really talking about skin cancer and testicular cancer, where we don't have a fancy blood test or a fancy scan to look for them. We rely on you to report symptoms. So we say to men that they should do a testicular exam in the shower once a month, the same way we say to women they should do a breast exam on themselves and report any lumps or changes that they can feel. Don't wait for a checkup. Come and see. And it's a little bit the same with skin cancer. When you come to see me, I can do a skin check and that's fine. But I need you to be on the lookout in the meantime, in between all those checks, to say, well, if there's a new mole or a changing mole, go and see the doctor about it. Other than that, there's the usual tropical diseases. We see, more gastro-infections, more dengue fever here. That's just that's a hazard of living in Singapore, and most of those things are manageable, and they get completely better. So, and for things like that, men will come and see the doctor. That's why I've dwelt less on the sort of the more discrete physical problems here, because if a man's got dengue fever, even the most belligerent man will normally come to see the doctor about it. So we don't need to worry so much about that side of things.
Yeah, definitely. Great. I think that's covered a lot of different things that we can look out for, we can be aware of, and we can try and sort of pass on to our partners. As you mentioned before, the house starts to burn down. I think that's really important. Singapore is, a leader of very busy lives here, and it can be easy to get caught up with things. So Thank you for just putting a spotlight on some of the issues that our partners might be dealing with.
I think it's a case of letting men know that we're here for them when we need them, both as doctors and partners, and encouraging them to seek help sooner rather than later.
Yeah, very important. Thanks very much.
Thanks, Anju. Anytime.
Thanks, Wise Tribe. Dr. Neil is based at Osler Health International at Vista, and you can book to come and see him anytime. Thanks very much.